Med Ed Bytes, micro, just-in-time education. Hi, this is Dr. Ria Temmerman, CRNA scientist and co-founder of Atomic Anesthesia, and I'm here to guide you through this Med Ed Byte. For this series, we're exploring a critical challenge in perioperative care, postoperative neurocognitive disorders that can dramatically impact patient outcomes. Let's focus on two key conditions, postoperative delirium, or POD, and postoperative cognitive dysfunction, or POCD. Postoperative delirium is an acute and fluctuating disturbance in attention, awareness, and cognition that occurs in the hours and days following surgery. It's characterized by disorientation, memory impairment, and often changes in behavior. What makes this condition so concerning is its prevalence and impact. It affects up to 50% of elderly patients undergoing major surgery and is even more common in specific populations, such as those undergoing cardiac or orthopedic procedures. The consequences of postoperative delirium are far-reaching and sobering. Patients experiencing this condition often face prolonged hospital stays. They're at increased risk of complications, including falls, pressure ulcers, and infections. Even more alarming, these patients are more likely to be discharged to long-term care facilities rather than returning home. Many experience persistent cognitive decline that can last months or even years after surgery. Perhaps most concerning is the increased mortality rate associated with delirium, both in the short term and up to 2 years post-surgery. But delirium isn't the only cognitive challenge healthcare providers face. POCD presents another significant concern. Unlike the acute nature of delirium, POCD is a decline in cognitive function that occurs after surgery and anesthesia, potentially lasting from months to years. It's characterized by a noticeable decrease in memory, executive function, and other cognitive abilities compared to the patient's preoperative baseline. Studies have shown that up to 30% of patients aged 55 and older may experience significant cognitive decline 3 months after major non-cardiac surgery. The impact of POCD on patient outcomes is significant. It can complicate recovery from surgery, delay discharge from the hospital, postpone a patient's return to work, and substantially reduce a patient's quality of life. While distinct from postoperative delirium, POCD can be related, representing a more subtle, longer-lasting cognitive impairment. The impact of these neurocognitive disorders extends beyond the individual patient. They place an enormous burden on our healthcare system, with estimates suggesting that delirium alone costs the U.S. healthcare system over $150 billion annually. For healthcare providers, particularly in anesthesiology, these conditions represent a critical challenge that demands our attention, understanding, and proactive management. As medical professionals, we must recognize the signs, understand the risks, and develop strategies to mitigate these potentially devastating cognitive complications. Our patients depend on us to provide not just surgical expertise, but comprehensive care that protects their cognitive health and overall well-being. In this Med Ed Bytes series, we'll dive deeper into prevention strategies and management techniques for these complex perioperative neurocognitive disorders. Medtronic, engineering the extraordinary.